my primary responsibilities was the implementation and the rollout of the Safe Patient Handling Program at Stanford Hospital Clinics. We've been working on the program since 2007 and have seen a major movement in the program since its inception.
If you're a mid-level manager that has been tasked with implementing a new Safe Patient Handling Program or taking the Safe Patient Handling Program to the next level, the first thing to recognize is this is bigger than just you. You can't fight this fight by yourself. You need to incorporate the other individuals that the Safe Patient Handling Program touches and affects.
So one of the things that we did was we partnered with key strategic partners within the organization. Nursing was a significant component to move the program forward, and so we gave them the lead, provided them the education. We took them to conferences on the East Coast to escalate their understanding of the problem, the issue, and the solutions associated with those problems. And then we helped them understand how the financial return was developed and showed the benefits associated with nursing staff as well as other caregivers. So from there, we developed an interdisciplinary committee that would participate in the program. You have people like infection control that need to participate. You'll also have workers' compensation, risk management, nursing, transport, housekeeping, all have to be a part of the program, which are going to be a part of the solution to move this program forward.
Forming the interdisciplinary committee is key. Bringing together kind of a think tank approach to the implementation and strategy is truly the first step.
I think with any program that you need to have oversight, and we have a very good program here with the interdisciplinary group that we have for the steering committee. They make sure that the policies and procedures are in place. They make sure that the daily operations go smoothly so that we can have a successful program.
Nursing engagement is difficult. This is their environment. You are basically asking for permission to change their workflow. And so there's a fair amount of pre-planning that goes into that. That's the marketing of the program, understanding the culture of the hospital. Each hospital is different. If you try and introduce various pieces of equipment at one facility, it may not work at another. It also depends on the evolution of the program, whether the program's brand new or on its 5th year. There's different ways that it has to be navigated. If the nursing staff have not yet seen any patient lift equipment, it's difficult to tell them, here's the lift, use it every time, and never think of doing it with your partner again. Additionally, listening to the nursing staff and being their friend is key. The Safe Patient Handling Programs should not be viewed as punitive for them. In many cases, administration wants to tell them, you need to do this or else. And at the end of the day, the nursing staff will just say, I'll just get it done with my partner. What we want to do is understand why they don't use the equipment. So listening to them and understanding the reasons why they don't use the equipment is because they feel that it's faster to get it done with the teamwork or the team lift approach. Additionally, we see that the nursing staff might say, well, I have to turn my patient 2 or 3 times just to get the sling underneath them, so I might as well just manually lift them. There's education that needs to happen, a knowledge transfer that has to happen in order for the nursing staff to understand why they need to utilize the equipment and the successful outcomes that will be achieved.
You can't just buy equipment. People need to know how to use it. They need to know how to use it safely and properly. And they need to know the policies and procedures in place to make sure that they are utilizing it. It's dignity for the patient. You know, no patient wants you to show up with a piece of equipment and not know how to use it.
Right. It's one thing to buy the equipment for the organization and to provide the initial training, but where I have actually seen the most impact is the ongoing follow-up by the manager and the buy-in at the frontline manager level as well as the staff, because if it's not considered an expectation, staff won't necessarily use it despite it being there and being available. So that's been the biggest change and the biggest eye-opener, I think, for us at the leadership committee level, and trying to change that culture.
Cultural change is something that can't just be achieved by turning on a switch. You can't buy culture, you can't do anything except for create culture. So it's a very strong committee support, a very strong program marketing support, making sure that the nurses' voice is heard as well as administration's voice is heard. Having the nurse understand, or the care staff understand, that while this is a compliance program, it's actually a gift to you and your patients. And so at that program, or that facility, it was launched on Nurses Week. And it was positioned as a gift to the nursing staff, and it was very well received that way. So on the same day that the program went live, they were actually handing out ice cream sundaes. So it's one and the same in the sense that one is a gift for the nurse on a job satisfaction standpoint, and the other one is just tastes good.
So some of the benefits associated with the program were about a $2.5 million reduction in employee injuries. We saw a reduction in lost and restricted days. We also started to see some ancillary benefits, such as patient referrals. Patient felt more dignified when they were transferred with the equipment, and so they would come back, for example, for their MRI. We also saw employee satisfaction increased. We saw an increase of about 7% in those areas where safe patient handling equipment was employed.
I think that knowing that my nurses can come to work every day and not risk injuring themselves, that they feel that they don't go home at the end of the day tired and in pain, and then not looking forward to coming to work the next day, or I run the risk of having them off work for weeks on end and potentially losing them as a nurse. It could end their career if they hurt themselves. I think it's worth having the lift equipment around. Yeah.
I think the key to our success is we developed a committee that was focused on it for all 4 years. It was an interdisciplinary committee, and they met every month, and they went over the results associated with the program, and they stayed consistent with the process.
The tipping point for the program is typically when the nurses say, I stopped going home with a sore back. I can live my life the way that I want to. Nurses didn't go to nursing school in order to manually handle patients. That's just a component of their job, or they've been told that that's a component of their job. They went to school to be nurses.
You know, I've had nurses tell me that the reason why they came to Stanford is because we have safe patient handling equipment here, and that they feel that they can safely give care to their patients and not have the risk of injuring themselves in that care.
So we saw benefits that were good for the patients, that were good for the caregivers, that were consistent with rehabilitation efforts, and also a significant financial impact to the organization.